Hello, I'm Dan Hawkins, Majority Leader of the Kansas House of Representatives, and again today I'm joined by none other than Beverly Gossage. Beverly, it's wonderful having you here today.
Pleasure to be here.
We're going to talk a little bit about rural health care, and you know, one of the things that Medicaid expansion folks have said for a long time is that Medicaid expansion is going to save rural health care, going to save rural hospitals, keep them in business. And you and I know that's not true.
No, it's not.
Across the nation, that's not been true. What's
No.
your experience as you have been traveling, or what do you have to say about that?
Well, first of all, let's just go back where this came from. Because the Hospital Association strongly supported Obamacare, helped to get passed. And the reason that they did that is they were promised by the Obama administration that these funds that you get, called disproportionate share funds or DISH funds, if you have indigents who come in and they can't pay the bill, we will reimburse you. Those funds that you get, we're going to take those away, but everybody in America is going to be insured. Well, everybody in America wasn't insured, and the rates were so extremely high. People were willing to pay a fine rather than buy a policy. And so millions were left uninsured. Plus, then the Supreme Court said, you cannot coerce states to expand Medicaid and threaten to take away their other Medicaid funds. That's unconstitutional. So
Imagine that. Federal government doing that to us?
Imagine that. So the Hospital Association said, well, wait a second, you said you're going to take away our DISH funds to pay for Obamacare. So we see other things like that happen, like the Cadillac tax and the HIT tax. These were all pay-fors that they just kept kicking the can down the road.
How about the Medicare? They took $711 billion out of Medicare?
Yeah. So they kept saying, you know, we are going to keep kicking this down the road, don't worry. We're going to put it in as we're paying for it, but we're never going to implement it. So instead they said, you need to go to each of the states and coerce them, get them to do this. So they started out with, what about this poor Medicaid population? And we're like, well, wait a minute. We already said that they are not the low-income families or children or pregnant women or low-income seniors and anybody willing to work for minimum wage for at least 30 hours. It's none of those people. Who are these people? Basically people who won't work, right? That didn't go anywhere. Nobody bought that. They weren't sold that we should do this with Medicaid expansion and all of the federal and state dollars it was going to require to crowd out other things in our budget. So then they went to, what about us hospitals? Because the more Medicaid people we have in our sphere of influence, the greater our reimbursement is from Medicaid for our DISH funds. So we need more people on Medicaid, basically. That will help our hospitals. And people actually didn't feel sorry for hospitals who are making billions of dollars. So that didn't work. So then they went to, well, what about these rural hospitals out here? Some of them may close. They were going to close anyway. It's an old model that really doesn't work. Mm-hmm. You know, you may know I went to Fort Scott Junior College. My family's from Fort Scott. And the Fort Scott Hospital has become the model. It's nationwide. Read about it in the Kaiser publication.
Absolutely.
They were $14 million in debt. You cannot have all of this staff, all this overhead, and continue to be sustainable. And even with everybody signing up for Medicaid who might be eligible, maximum they were going to get was $2 million.
That's correct.
There's no way, right, that they would have sustained that. So they said, we need to restructure. So they closed the hospital, but they reopened. And now 90% of the services that they offered before are still available. They went with fewer beds, and they are also now going to be selling part of that facility. The community is very excited about it. Other hospitals need to take a look at that and not say, let's just expand Medicaid so maybe that'll help my rural hospital. And I honestly feel sorry for those senators that are getting pressure from people at their constituents who don't understand this issue and know this is just a way to expand government. It is not going to save your hospital, because what we've seen is the rural hospitals in Kansas, or the hospitals in urban areas in Kansas City may get floods of money. They're going to get a dribble. In these rural hospitals, it's not going to save them at all.
7.4%. The critical access hospitals in Kansas, if Medicaid expansion were to happen, we get 7.4%.
Yes.
The top two, KU and Via Christi, would get 25% of all dollars. The top 10, 55% of all dollars. So who gets it? The big hospitals.
Right. And who's pushing this?
The big hospitals.
Right.
Absolutely. So that's the reason why we keep telling you, and I was glad that Beverly brought it up while we were sitting here. before we started videoing is that rural hospitals are not going to have a panacea out of this like they thought. So.
No. And hospitals that in states that did expand Medicaid, still closed.
Closing. Absolutely. Arkansas just had 2 large hospitals closed within the last year. So, well, thank you for joining us. Stay tuned because we got some more videos coming your way.